Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be the facilitator for today's session. Today we have with us Lucy Barylak and Dr. Elliot Sklar, and we are starting a series today on, let me get over here, a program for healthcare workers and talking about engaging caregivers. And our topic for today is defining caregivers and recognizing their experience. Before we get started, let me go ahead and introduce Lucy and Elliot to you. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. She would also like you to know that she was a caregiver for her mother for about 10 years. Now let me tell you a little bit about Dr. Elliot Sklar. He is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregivers. Welcome, Lucy and Elliot.
Thank you so much, and welcome to our participants today. As you had mentioned, this is, and I'm sorry about my voice, my allergies are acting up, so please forgive me if I do have to clear my throat. But today is part one in a three-part series that we have, and after our formal presentation today, we will be having an unrecorded 30-minute program for you to just ask questions if there's anything that you want to discuss, or if there's some difficult things that you're dealing with some potential caregivers. We welcome you to participate during that time. We've received some very interesting questions because this is a dynamic issue. The issues are always changing, and it's been very interesting to see what healthcare workers are currently experiencing. So because this is a learning series, we do have learning objectives, and today for our first program, we are going to describe family caregivers and their challenges. We will discuss the role of family caregivers in terms of care planning. We're also going to review some physical and mental health concern issues and areas among caregivers, including addiction. And as always, we're going to provide resources for you all to take with you. And we will be providing a copy of our presentation slides for those who registered for our program today.
So good morning. Thank you for that, Elliot. Good morning, everybody. I want to tell you that frontline care workers are the backbone of effective health system. They are often based in community and come from the community they serve. They play a big role in providing services, solutions, referrals, and prevention to families, individuals, caregivers, and care receivers. That during the pandemic, the role of the caregiver gained a new attention, and the role became even more crucial. We know, however, that the role of healthcare workers is focused on patient care and patient-centered outcomes. Often little focus is paid to the role of caregivers in supporting those patient-centered outcomes, but not in all cases, okay? We know that many healthcare workers are also focused on the well-being of caregivers. But what I want to say is that because of that, because it's so centered on patient care, Elliot and I decided to do a session series on really exploring what are the needs of caregivers in service provision and how can healthcare workers advocate for caregivers' rights.
It's a very important issue.
Yes, it is.
So we first need to look at who are these caregivers that we're talking about, because when you went to school to study whatever health profession you may specialize in, Most often, you were learning about patients and about prevalence of disease, not focused so much on caregivers. And that's a huge area where we need to do more in the way of teaching our future healthcare workers and professionals because it is so important. And additionally, we need more data, I think, too, about caregivers. And I'm going to ask for your help with this as well for those participating, because the latest data that we have is from a 2020 report that was coordinated by the National Alliance for Caregiving and the AARP. And the 2020 data is the most updated that we have, but I really feel like it's missing a lot because it doesn't reflect the experience of COVID. And we know, as an example, since COVID, some nursing homes, for example, people died in nursing homes, which may have impacted at certain points the number of caregivers out there. At present, there are also staffing shortages, which Lucy and I have explored in previous sessions that we've talked about. And as a result of these staffing shortages, there are very long wait times for admission, which put more strain on caregivers, and it also extends the duration of time that caregivers are providing care. So these were just some thoughts that I had about how COVID may have potentially changed the demographics that you see here about the number of caregivers, and that really all caregivers are on the increase. So I was curious if anyone has any thoughts about how COVID may have changed some other issues or demographics for caregivers.
And just a reminder, if you would like to join the conversation, just unmute your microphone, raise your hand as far as Zoom goes, and you can also enter something in the chat box because that will remain open throughout the session today.
Well, as people are thinking about it, what sort of popped into my head is that because of COVID and the death tolls and long-term care and nursing homes, I think a lot of people are more wanting to stay at home and are fearful, caregivers are fearful to transfer their loved ones into a care home. And I think what that says to me is that, do we need to look at how we provide home care services?
Those are great points, and they changed the demographics. Between 2015 and 2020, the number of family caregivers in the United States increased by 9.5 million. Now, I would suspect that since COVID, because of what you just said, Lucy, the fact that people are perhaps a little bit more hesitant to place a loved one unless they absolutely have to, that may be creating a greater number of caregivers. And as I said earlier, it may extend the duration of caregiving, which may put more strain on caregivers. But according to that last report from 2020, family caregivers make up more than 1 in 5 Americans. And that has a lot of implications linked to health and also just to finances, to social interactions. As we know, caregiving impacts everything, just like when you have someone who is sick at home, that impacts everyone in the household. So what I think was interesting from the most recent data that we do have is that the majority of caregivers are baby boomers. And though there are more younger adults becoming caregivers, 61% of those baby boomer caregivers and overall caregivers were women, and 39% of them were men. And I suspect that due to COVID, that will have changed too. We know that there are financial inequities for caregivers, certainly. About 61% of them work, 45% have had at least one financial impact as a result of their caregiving role. And a good example is being passed up for a promotion because you are frequently taking time off to take someone to medical appointments. And there are others, certainly. But more than a quarter of family caregivers reported that they had difficulty coordinating care. And we know that there are health inequities among diverse caregiver populations, even between caregivers who are men and women. And these are themes that we are actually going to touch upon during our last session in this series. But I wanted to give you some ideas of how the health of caregivers gets impacted by their role. 1 in 10 caregivers reported that caregiving had caused their physical health to get worse. caregivers also report a larger number of chronic health conditions at nearly twice the rate of non-caregivers. And this is important because when you look at a baby boomer population, certainly you'd expect to see more chronic health conditions as we age, but in comparison to non-caregiving peers, those chronic conditions were almost twice the rate. There are also inequities in gender. Women providing care to an ill spouse are more likely to report a personal history of high blood pressure, high cholesterol, high sugar. Women who spend 9 or more hours a week caring for an ill or disabled spouse increase their risk of heart disease. So the key here in just illustrating some of these statistics is that in my mind, they also present a concern for healthcare workers. Because as healthcare workers are reliant upon family caregivers to participate in the delivery of care, just as Lucy had said, then that makes it very important that we also try to preserve the health of caregivers as much as we can. And it becomes sometimes a challenge because, as we both said, patient-centered outcomes are key. But do healthcare workers also have an obligation to support the well-being of caregivers? And it's really an ethical question in my mind that I think we'll discuss throughout our series. There are some quick facts here for you as well, and you don't need to remember all of them. I'm not going to go through all of them either. They're just examples of some things for you to think about. As I said, we'll be providing a copy of these slides. But I think what's important here is that caregiving and caregivers as well, we change over time. And our trends in our society change too that we may not think a lot about. There's a lot of data and statistics here on these slides, but some of the newest data that we have about who caregivers are and what their issues are comes from the University of Michigan's National Poll on Healthy Aging. Their 2022 report indicates that more than half Americans are aged 50 and older who are helping another older adult to manage tasks ranging from household chores to medical care. That's a big one, more than half. So something people don't think about right now is that people are also having less children. People are having children older in life, and people will need more care later as we age. So there'll be less sharing of those responsibilities, for example, among siblings down the road. These are things that a lot of millennials and Gen Xers should be thinking about, but we don't. We should be thinking about how to save for long-term care, but we don't. Some other ways that social trends impact caregiving, as an example, more older adults these days are divorced than generations before them. More older women are living alone and aging alone. More than half of women 85 and older live alone. So nursing homes become the only option for some adults who do live alone. And due to staffing shortages that we talked about, there can be long wait times. So we need to think of aging and caregiving as evolving, I think, too, because the issues and the needs of both patients, caregivers, and things that are happening in our society too, they change. A few years ago, many of us never anticipated COVID and what that would have done and the stress that that would have placed upon caregivers. Some of us are still recovering from it or haven't even yet. So I think that it's important to see these things as not being static, but rather as evolving.
You're making a very important point because, in my work, I'm always challenging our staff to look at questioning practice. Like, what has changed? Do we go about doing the same thing over and over again? Or do we have to look at what happened and what are the needs? I'm going to talk about a research that was done in a home care department. It was really quite an interesting what the study showed. And these were all healthcare workers. And we looked at how do healthcare workers actually look at the caregivers? Do we see them as a resource? Do we see them as a partner, or do we see them as a client? And the findings were very interesting. It has been largely demonstrated through research and working in the field that without the support of family and friends, majority, as we said, are mainly women, it would be impossible to maintain people with major disabilities in the community. We know that family caregivers pay an important price at all levels for their involvement in providing care. But most models of care and service delivery regard caregivers as a resource for maintaining frail elderly or those with any form of dementia at home. Some healthcare providers feel that caregivers should be performing those duties, regardless of how many tasks are involved in the care. As well, many perceive that it is the family's duty to provide care. There's also an expectation at times to develop skills and knowledge in nursing, rehabilitation treatment, and equipment maintenance. Many caregivers themselves don't see themselves as caregivers, but only as a wife, a husband, partner, child, etc. In order to support and make sure that caregivers care for themselves, healthcare workers are the key in providing, identifying, and advocating for caregivers' rights. Caregivers need to minimize their own, they have to maintain their own well-being in order to care for their loved ones. So let's take a look at all this, what I'm talking about. So when we look at a resource, so what is a resource? A resource provides the right information, support at the right time. A partnership is an arrangement where parties agree to cooperate and advance their mutual interests, being equal in decision-making. So that's the key word. And as we know, a client is a person who needs services. So let's go back to, when I talk about a resource, okay? So is it right to expect caregivers to be a resource in certain circumstances? And if the caregiver is able and willing to perform certain tasks daily, then yes, why not? However, when the caregiver cannot because of their own limitations, age, or unwillingness, then whose responsibility is it? I think that we all need to look into our own value system, our cultural background to answer those questions for ourselves. For example, do we expect a daughter who is capable to perform certain nursing tasks for her mother, like learning how to give insulin shots? So now I'm going to give you my own experience of what happened to me. I was a caregiver to my mother. She developed diabetes. At the time, I was working full-time. I still had 2 kids at home, family to raise, and I'm an only child, and I'm petrified of needles. And when the nurse wanted to train me to be able to give my mother the insulin shots, I was petrified. I have to say, even thinking about it now makes me feel uneasy. I was afraid of, will I hurt her? Will I do it properly? And when I said no, I could see the look on the nurse's face. She was judging me. I think she felt that maybe I wasn't a caring daughter. So I'm not saying in all situations that it shouldn't be. Yes, if some people are able and willing to do these things and they want to, but we have to be very sensitive and to recognize that if we have a caregiver who's reluctant to do so, there might be reasons behind it and to find out what it's all about. So having said that, my question to you is, what are your thoughts about caregivers as a resource? Do you feel it's a natural thing? Let's talk a little bit about it.
Excuse me.
I know it's a lot to think about, and maybe some of us haven't even thought about that, but it's, it's food for thought. So even though you're not going to answer it now, think about it, and maybe think about it for yourself as well. Because I think our own values do come into play, even as professionals, and we really have to step back and not bring that into our service provision. So let's look at, we talked about partners, so we did resource, okay. So what does partnership mean? So being equal in decision-making, the important things to keep in mind is that caregiver knows their loved one better than anyone else, but they also know their limitations. It's important in a partnership to ask what the person needs or what they feel they can do and manage. Negotiation is the key factor in a partnership relationship. And ask yourself, and this was part of the research, do we really see caregivers as a partner in care? Are they invited to case conferences when they're being presented? Do we include them in service provision? Let's say flexible hours when it's better for them. These are questions that are important to think about, because a partnership is just that. And really, to help them, how do they fit into this whole partnership thing? I think I saw something on the chat box. Should we
Yes,
go with that?
Leslie had a great comment. I believe that our society does not enable people to naturally caregive. For example, working full time, raising children while caring for a parent.
Yeah, that's a very important piece for sure.
100%.
Yeah. So again, when we did this research, some practitioners, some healthcare workers are saying, no, we don't include them in case conferences. We just assume that if we have certain services, it's at certain times of the day. But what's so bad if we did it in the evening? Is it possible to change things around? And I'm not talking about more money, the same funds, but just kind of look at them in a different way. So I would like to ask a question or any thought. Can anyone give us an example of how you negotiated with a caregiver in providing the care for their loved one as a partnership and even as a resource?
Please feel free just to open your microphone and join the conversation with Lucy and Elliot.
Well, think about that, because maybe if you want to, after we finish, we can talk about it in the half hour or bring it up anytime during our session. So now we did, resource, we looked at the partnership. Let's look at them as a client, our caregivers, potential clients, because in reality, caregivers can be resources, they can be partners, they can be clients. Since we know that caregivers are at high risk for burnout, depression, physical and mental disorders, we need to be mindful that they may need help as well. So being a client means that they hopefully will receive possibly services when needed, and the expectations that are associated with caregiving will be somewhat of a diminished for them. As a client, they also are giving permission to care for themselves. So what I mean by that is, if we do look at them as clients, there's a lot of prevention that can be done periodically. Maybe they need a little bit more support right now, so they're perceived as a client, they receive the support, but it doesn't necessarily mean that it can go on. And it could be counseling, for example, that they really need at this period to talk to someone and to vent, and that you're there for them also, but they're still a resource, they're still a partner, but they're also a client. So can anyone explain why we need to consider caregivers as potential clients above and beyond what I just talked about? And I think I saw something on the chat box.
That actually touches upon your question very well. Leslie said that she changes her own schedule to meet that of a caregiver when providing services as an occupational therapist, which is such a great example of the flexibility that caregivers need. And I want to thank you for that.
Yeah.
And Julia said, many times caregivers are left out of the picture for various reasons when they are the most valuable piece of information. I've seen it many times as a nurse, personal caregiver, and family member, being an advocate for the client, patient, etc.
Thank you so much. It's exactly what I'm talking about. And it goes back to ourselves, to our own practice. We all have our own practice within a setting, right? Is how we see the clients, our perceptions. And so that is so important to look at. And I thank you so much for your comments, because they say it much better than what I was trying to explain. So thank you for that.
Well, it's always nice to get comments and feedback from our participants, because it also helps us to know that where our thinking is in alignment with yours. Certain things, Lucy, as you were speaking, came to my mind. Do we think of caregivers as a resource? Well, isn't it interesting how we're always so focused on providing resources for our caregivers with our program every time that we do it? And partnership, that word that you included of negotiation, I think it's something that we do much more than we might necessarily think, but we have no choice. And to Julia's comment about caregivers being left out for various reasons, I completely agree with that. And I think, sometimes it's caregivers who actually a healthcare worker has the most interaction with sometimes. For example, if you have a patient with advanced dementia or Alzheimer's, though you might be providing direct care for that patient, the actual interaction that you have most of might be with a caregiver. So it's again so important that we continue to just remind ourselves of this and the people we work with, because we don't even learn in school how to communicate with caregivers, and it's so important. We did get another message here from Nancy. It's been said that the patient family is the most underutilized resource in healthcare, which I thought was a great comment as well. And Andre said that beyond the important and precious role of the caregiver, I think that recognizing them as a key person central to the care process is a legitimate and necessary act of respect for their engagement and devotion. I could not have said it better myself. Thank you, Andre.
And always taking into consideration the person's background and cultural, just to have a really good understanding where this person is coming from and what they are able. And sometimes we even have to give caregivers permission and say, you know what, this is too difficult for you to do. This is goes beyond what needs to be done. Because a resource, if you remember how I sort of, a resource is anytime. So can caregivers be resources 24 hours a day? I don't think so.
I agree completely. And all of this touches for me very closely, obviously, to what it is that I do as a faculty member teaching health science, and why we both felt that this was so necessary for healthcare workers. I teach doctoral students a course called Leadership for Conflict Resolution. And what we fail to recognize is that in life, the leaders that we learn from the most, they often take place in our childhood and our upbringing. They may be our guardians, our parents, our grandparents, but there is some leader. It could be a maternal leader, a paternal leader, but we learn a lot from that leadership growing up. And Lucy, you say to look at the culture that a person comes from, their background. It's so important because that also influences how we deal with conflict. And for caregivers, at times, conflict might be inevitable. I wanted to touch upon this because I think this is such a great lesson from conflict resolution, from a different lens, because it's not one that we usually employ when we talk about caregivers and their role. So when we teach health students, we teach them that care is patient-focused and that caregivers are secondary. But if you look here at how primary parties are defined and secondary parties, where do you see the role of caregivers? So primary parties are the main individuals or groups involved and without which the conflict or dispute cannot be resolved. Secondary parties have influence or interest, but are not directly involved. And when I think about all of the comments that we've received in the chat, it's very clear that many of you see caregivers as a primary party. And I think that that's right on the money because I'm sharing this. To me, this is an interesting lens because it really reaffirms that caregivers are primary. They're not secondary. They're up front and center when it comes to the health of a patient. So perhaps we all need to shift our thinking a little bit in terms of how we view care and the people that are responsible and play a role in providing it. Now, with that said, we hear the buzzword self-care all the time these days, but I really believe that self-care becomes all the more critical and important and something that we need to encourage practice of. We all hear that. I know we all do, but we don't practice what we preach. And I really believe this is especially true for healthcare workers. There's a reason that all of us are in the helping professions. And when we embark upon careers whose focus is to care for others, we sometimes lose sight of the fact that we also need to put ourselves up front and center as a primary party involved, just like what we're seeing here. So if you have lost sight of the need that you need to care for yourself and your colleagues, please take this as your cue to remember. And that can be a 5-minute pause. It can be taking a hot shower with a nice piece of music, or just anything that brings you some sense of grounding and calm in your day. It's really important. Now, we know from research about the health effects of caregiving on health and well-being. For example, if you're a caregiver and you're caring for a spouse who may be between the ages of 66 and 96, according to research, if you're experiencing mental or emotional strain, you have a higher risk of dying than people who are non-caregivers. And there's more and more and more data that supports the significant health problems, earlier death, et cetera, physical demands that come along with caregiving. But older caregivers are not the only ones who put their health and well-being at risk. Baby boomers who've assumed caregiving roles, and earlier I mentioned that baby boomers are the largest group of caregivers. Baby boomers who may have assumed a caregiving role for parents while simultaneously juggling work and raising older adult children, even, you face an increased risk for depression, chronic illness, as well as a possible decline in quality of life. And despite all the risks that are out there, family caregivers of any age are less likely than non-caregivers to practice preventive healthcare and self-care behavior. And that's why we bring this up, because it's really important. If you are working with patients and you see that caregivers are not quite looking themselves, or they look disheveled, or you sense that something is not quite right, please discuss it with them. Encourage them to seek care if they need it. I know that there are sometimes issues of how to make proper referrals and how to log cases and conversations, but it is really, really, really important, because a lot of caregivers have a very hard time attending to their own healthcare while also managing caregiving responsibilities. And across the board, caregivers report sleep deprivation. We know that that's a huge one, and it can impact everything from your mood to how you feel. Poor eating habits, not having the time or energy to exercise, not caring for yourself when you're sick, or, as we said earlier, postponing medical appointments. So very important to, try to keep this in mind. And I see we have a question or a comment from Leslie. Out of curiosity, what about young adults 20 to 40 who are caregivers to a parent with dementia and the primary parent caregiver? It's an excellent, excellent question. Actually, I think it's a couple of months now that I did a program focused on specifically younger millennial caregivers and the issues that they face. A number of them feel that their social networks are interrupted, and also that their careers have been stalled, or that they have major financial issues as a result of their caregiving role. It's really important to connect these younger adult caregivers to resources that are age appropriate and specific for them. I even did a program about college students who are caregivers, because there is actually about 10% of caregivers who report being college students, and yet no colleges or universities pretty much have any kind of caregiver support, which is an issue not just for caring for older parents, but also for children who might have disabilities or health issues as well. So it's really important to connect those people with the appropriate resources. And Leslie, if you look on the WellMed Charitable website, WellMed Charitable Foundation website, under our previously recorded programs, if you look up millennial caregivers as the keywords, you should find that program recording. But it's a great question that you asked. And there is also research to suggest that millennial caregivers are at greater risk for health issues as well, just like their older peers. So a lot of important stuff there. But I think it's so important as healthcare workers that we ask ourselves and our family caregivers a couple of important questions that are not part of our normal interactions and conversations. I love this question because we never ask this of ourselves or of other people. But what do you need today to feel taken care of? And that can take a long time to come to an answer, but it's a really important one. And to ask and to listen to the question, how are you feeling today? You know, we always ask people, how are you? Fine, fine. But caregivers might not be fine. And it's important to ask some questions, to listen, and to remind each other and our caregivers of the importance of self-care. And consider this our reminder to you. Leslie said, thanks for the answer. I was curious about the statistic and research. There's not a lot out there. It's an area of research we need to do more of, younger adults, millennials. Also, I started talking a bit earlier about the trends in our society are changing. A lot of younger adults are having less children or having children later in life. These present a lot of caregiving issues. So certainly invite you to listen into that recording and to stay on for 30 minutes after our program today to talk a bit more about that.
Thank you for that, Elliot. Yes, there is quite a bit of research being done here in Canada on younger caregivers. We can talk about it a little bit later. I do want to talk about the impact of caregiving and caregiver mental and emotional health, okay? The psychological health of family caregivers is negatively affected by providing care. I mean, you could understand higher levels of stress, anxiety, depression, and other mental health effects are common among family members who care for an older relative or a friend. No, studies consistently report higher levels of depression symptoms and mental health problems among caregivers. It's estimated, it shows that between 40 to 70% of caregivers have clinically significant symptoms of depression. That means that they're not just sad or unhappy, they're clinically depressed, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for major depression. And when you're in major depression, you're really not functioning very well at all. So both caregiver depression and perceived burden increases as the care receiver's functional status declines. Thus, higher levels of clinical depression are attributed to people caring for individuals with dementia. Studies show that 30 to 40% of dementia caregivers suffers from depression and emotional stress. And you can very well understand that. You can communicate with the person. Many times the person is not willing to, you know, they're physically, mentally, emotionally, could be verbally abusive, physically abusive. Depression and anxiety disorders found in caregivers persist and can even worsen after the placement of the person in a nursing home. Many caregivers who institutionalize their relatives report depressive symptoms and anxiety to be at a high as it was when the care was in the home. So I think that's important for clinicians to keep, to be aware of that even if they made a decision to transfer, they can become depressed. So we really have to be on top of it. Depressed caregivers are more likely to have coexistent anxiety disorders. It kind of goes together. A lot of substance abuse or dependency and chronic disease. Depression also is one of the most common conditions associated with suicide attempts. So these are some of the things that we really need to be aware of. I do also want to talk about caregivers suffer from higher levels of stress and frustration. Caregivers their stress is really quite high. They also describe feelings of anger. They're drained, they feel guilty or helpless as a result of providing care. And these are all the things that, sometimes people show this, but not directly saying it, but are very angry and frustrated. It's part of the healthcare worker to really try and identify where is this all coming from. Some 16% of caregivers feel emotionally strained, and 26% say taking care of the person they're caring for is hard on them emotionally. And additionally, 13% of caregivers feel frustrated with the lack of progress made with the care recipient. It is frustrating, especially with dementia as they decline. Caregiver can also result in feeling a loss of self-identity. You lose who you are. There's lower levels of self-esteem, constant worry, or feeling uncertainty. Caregivers have less self-acceptance and feel less effective and less in control of their lives than non-caregivers. More than 1/5, 22% of caregivers are exhausted when they go to bed at night, and many feel they cannot handle all their caregiving responsibilities. Caregivers who experience chronic stress may be at greater risk for cognitive decline, including loss of short-term memory, attention, and verbal IQ. So all these things, as healthcare workers, we have to be very cognizant of and be very aware of, and be able to really try and be there for them. You know, family caregivers are also at an increased risk for depression and excess use of alcohol. I want to talk about that, tobacco, and other drugs. Caregiving can be an emotional roller coaster ride. On one hand, caring for your family member demonstrates love and commitment, and it can be very rewarding personal experience. On the other hand, it's exhausting, worry, inadequate resources, and continuous care demands are enormously stressful. So let's look at what is addiction, okay? It is a disease. Over time, addiction can physically change a person's brain, the way they behave and act, and even aspects of their personality. The disease of addiction must be treated like you would treat diabetes or any other illness, and involves a treatment plan and good support system. So as a healthcare worker, it is very important to be aware that caregivers and their loved ones may be suffering from any form of addiction. In the past, people often spoke about addiction as a lack of willpower, a selfish act, as an expression of weakness. They're weak, stop drinking or stop doing what you're doing. This is not the case. As I said, addiction is a disease that over time can physically change the person. The disease of addiction must be treated like any other medical problem. Now, let me look at a bit of statistics for you as well. Substance use disorders among older people are among the fastest growing health problem in the United States. And this was by a research done in 2020. Moreover, the prevalence of substance use disorders remains high in baby boomers generation as they age into later life. With substance abuse includes drugs, could be alcohol, could be tobacco, cannabis, prescription medication, even over-the-counter medications like pain pills, shopping addiction, gambling, cyber addiction, and sometimes binge eating, sex, and others. So please be aware that if you're dealing with older adults, there is a risk that they could be addicted to something. I also want to talk a little bit about addiction behaviors. I mean, what do they look like? So as a healthcare worker, if all of a sudden you see that there is a change in the person and the caregiver, so let's just look a little bit of what addiction may look like. So there's like a lack of control. They're kind of all over the place. They're not really functioning very well. There's decreased socialization. They're isolating themselves. They're withdrawn. Distinct change in sleeping habits. So it's important to ask these questions. Are you sleeping? Are you eating well? They're either sleeping too much or sleeping too little. There's constant chronic fatigue. They're really, really tired. Constant illness. They're always getting colds or flu or whatever. There's injuries. They're falling. Obviously, if they're addicted to certain things, they're not balancing well. There's physical changes. The bad skin, believe it or not, they can have rashes, they can have pimples, they can have dry skin. Hair is falling. Teeth, they're not, the teeth give us bleeding gums, things like that. Your nails, if you look at your nails, if there's a change in color, it could also give you some sense that something's going on. And believe it or not, even memory loss. And we talked about depression, obviously. And then there could be the whole issue of aggressive behavior, or they don't really care. There's apathy, and there's just withdrawn. So, I really would like to have a little bit of a discussion for anyone. Let's talk a little bit about addiction, have you seen anyone in any clients or any caregivers that you feel might be experiencing a form of addiction? And the other question is, do you ask the questions that might give you the answers that you need because you see that things have changed? So I'm going to leave it at that, and let's have a bit of a discussion.
Please feel free to join in. We always learn so much from the participants on these sessions.
While people are thinking about it, what's quite interesting is some of the latest research about marijuana use in the United States shows that the group with the largest increase in users are baby boomers. And it's actually resulting in some increased falls among baby boomers because people are mixing alcohol with marijuana and also sometimes edibles. And then you don't know how it's going to affect you or when. It's quite interesting research that just came out. And the other thing that I think is so relevant here is that a lot of the signs of addiction, I think, mirror the experiences that we've talked about for caregivers. As an example, decreased socialization. Yes, that is a sign of addiction, but it is also sometimes symptomatic of being a caregiver. When you have less time, you do withdraw, or you feel that people can't necessarily relate to the experience that you're going through. We know that there is fatigue, changes in sleeping that occur with the role of caregiving. So certainly addiction can compound upon that, but it can also be mistaken one for the other. Same at times with chronic fatigue or illness. And this is why it's such an important issue that we bring up for healthcare workers to consider, because we know certainly that caregivers decompensate at certain times because caregiving may be more demanding at one period or another. There might be an adjustment period to the new demands. Emotional dysregulation is something that caregivers often experience because when we're tired and we're feeling stressed, we are feeling emotional. Sometimes there's anticipatory grief, depression. There's so much. And that is also why people turn to substances too, for a little bit of relief. So it's such a complex issue, and there's very little research about caregiving and addiction. I'm glad to see that the WellMed Charitable Foundation is one of the few organizations that actually do have programs that focus specifically on this topic, because it is a very important area that I think we're going to see increase as we see younger caregivers, to Leslie's comment earlier, but also looking at the demographics of substance abuse among baby boomers.
For sure. And as you said, being a caregiver, many times you're isolated. You're not going out as much, and people are not as much around as they were before, especially if you're maybe taking care of someone with dementia. And so it's easy to get into a pattern, 5 o'clock, have a little drink, take a bit of wine or whatever it is. And before you know it, you get into certain patterns because you feel isolated, because you feel alone, because you feel that. So it's so important to be able, if you see a change in the person that you're, in a caregiver that you know, or even in the person that they're caring for, to be able to ask the right questions, to be able to be sensitive enough and to recognize that this might be an issue. I saw something on the chat.
Yep. Andre shared, and I will read his comment in a second, but Lucy, what you said resonated with me in the sense that I think this is something we all experienced during the pandemic. And many people turned to a substance, food, anything to quell that withdrawal, that disconnect, that feeling of lack of ease. But what many of us don't realize is during that time, we were caregivers to ourselves or to someone else, because none of us had ever endured a pandemic or quarantine before. So to Andre's comment, I had to do extensive reading in the last couple of months while working on a project for a geriatric emergency care team. And one excellent article was indeed mentioning this issue. For instance, the need to include substance use in a geriatric assessment with the baby boomer generation. There is an increase of emergency visits of seniors who are victim of accidents post-substance abuse. And Leslie asked if Andre could share the article link, which if you have it available, please feel free to share it in our chat box. I will also try to find that article and include it with our resources along with our program, which brings me to, of course, our resource slide, because that's so important. And again, I mentioned that for those of you who registered for our program today, you will get a copy of all of this. I do also want to mention that if you have not yet registered for our program next week, I've included a hyperlink here. So when you do get our slides, you can just click on the link that you see for part 2 of our program under Join Us Next Week. And I know, as always, Glenda's going to have some announcements to make. We always open it up for some last questions or comments, and a reminder again that we will be staying on for an unrecorded discussion after our program today.
I just want to say one thing, Glenda, just one.
Yeah, go ahead.
What I think is so important that was brought up, just because we work with a tool for years and years, doesn't mean that it should not be revised when things change. So yes, it is important to ask these questions. If someone is like, by asking the right questions, you're going to get some answers in some ways of really actually identifying what are the services that this particular person needs. Thanks for that few minutes, Glenda. It's yours now.
I hope that you will forgive me, but I have a little message I would like to share with our healthcare workers and other caregivers that are on the line. And that is, as you work with caregivers, please encourage them to plan. And I will give you a brief instance of why this is so important and why I'm sharing this today, Lucy and Elliot. I have a 81-year-old friend who has dementia of the Alzheimer's type and is still living at home. She recently had a healthcare crisis and reached out to myself and a friend of ours. And when we contacted her primary caregiver, she had COVID. So she could not be present with our friend. One friend, my other friend, went with her in the ambulance to the hospital. When she was released, I met her at rehab. So we were her caregivers. There was not a plan in place. And so I would just like to encourage you, as you work with caregivers, encourage them to put a plan in place, especially in an emergency situation. I know she didn't think that would ever happen in a million years, but we just never know. So Lucy and Elliot, thank you for letting me share that information.
Very good.
And continue our series next week on Wednesday, September the 13th at 10 o'clock. Lucy and Elliot be back in the series and talking about difficult situations and elder abuse. A difficult topic also, Elliot and Lucy. So I would encourage you to join us. Let me see, our calendar is just jam-packed full. If you have not received the September calendar, it's available on the Caregiver Teleconnection website, or you can call our customer service representative to receive that. Which reminds me, if you did not register for the call today and you want a copy of the presentation, just call our customer service representative and she'll be happy to share that with you. Let's see, I see on Monday, September the 11th at noon, Karen Zeman, I do not know her, and I apologize, Karen. Self-care for real people. So, Elliot and Lucy were talking about self-care. So here we go. Here's your opportunity. And then I will be back with you with Dr. Tam Cummings on Tuesday, September the 12th at 1 o'clock. And this is one in our series of Ask Dr. Tam. So we have some new conversation in our chat box, Lucy and Elliot.
It was related to finding and sharing the article that Andre had referenced. So I've shared my email, and hopefully we'll get a copy of that I can send out with our resources today.
All right. Let's see. We have about 3 or 4 minutes. If anyone else would like to join in the conversation, we would love to hear from you.
Nancy also shared this was in the news recently. For the first time, traditional Medicare will pay to support family caregivers. And this article came out just about 2 weeks ago. Thank you for sharing that, Nancy.
Wow, I didn't know that. See what you learn on these sessions?
We always learn so much from one another. I know that there was a move to do this in Washington State, but this is very exciting. And thank you, Andre, for sharing the reference here. So it's trends in emergency department visits associated with cannabis use among older adults in California. And it includes a data analysis from 2005 through 2019. Does anyone have any last questions or comments for us before we end our formal presentation for today?
Well, I encourage you once again to look at the September calendar. We were a little slow in the summer, and that's intentional, but we are back in full swing for the fall. So we hopefully will see you on future calls. Let's see, we have a couple more minutes. It's not too late to join in the conversation.
Thank you, Pierre, for your comment. And we also welcome those of you who can stay on for an extra 30 minutes. Please stay on with us.
So maybe we could take a little break and we'll come back.
Absolutely. I'll be leaving you at this time and I'll be stopping the recording. So thank you for joining us today. And I look forward to seeing you next week. So bye-bye.
Bye, Glenda. Thank you so much.
Thanks so much, Glenda.
Bye-bye.
Bye-bye. Thank you for your comments, Shane and Andre and Leslie as well. We'd love to have you stay on with us if you can. This will be an unrecorded, unscripted portion of our time together. You can also change your name. Minerva has entered information in the chat box if you do want to be anonymous. We've had some healthcare workers share some really far out there experiences and situations with us to get some other input. Always great to get some other ideas. So please stay on with us. We're going to take about a 2-3 minute break to use the restroom, do what you need to, get some more coffee, and we will be right back.
See you soon.
All right, well, it looks like we are all back. So
Yes.
I want to thank you
Sorry.
to those of you who have stayed on with us and invite you to share some questions or comments or feedback that you have.
Keep in mind that this is the informal section, so it doesn't have to pertain specifically to what we discussed today. It could be anything else that you have a question on.
Thank you, Minerva.
Sure.
Yvette, I see that your mic is unmuted. Did you have something you wanted to share?